I'm Evan Feigenbaum, the Vice President for Asia at the Carnegie Endowment for International Peace. The COVID-19 pandemic has stressed public health systems and political systems in every corner of the world. But when the story of the pandemic is written, some of the greatest success stories in managing and mitigating its effects will be in Asia. And perhaps the greatest of those success stories will be Taiwan's. Taiwan has not only managed and mitigated the effects of the epidemic successfully, but has leveraged an incredibly innovative use of technology to do so, including the integration of national health and immigration databases, the geolocation of cell phones to enforce quarantine, and innovative social behaviors involving the adoption of masks and changes in personal and group behavior. We talked to Lin Xianhe, one of Taiwan's leading infectious disease specialists, a professor of epidemiology at National Taiwan University, and the director of the Global Health Program in the College of Public Health at National Taiwan University, about how Taiwan has been so successful, what it learned from the SARS outbreak in 2002 and 2003, and in particular, what lessons from Taiwan can be exported and scaled to become best practices everywhere in the world. Dr. Lin, I'd like to start with the SARS outbreak in 2002 and 2003, which was clearly a very searing experience for Taiwan and for many others in Asia. And it was an epidemic from which Taiwan clearly drew lessons that prove useful in the current outbreak of COVID-19. So can you start by talking a little bit about how SARS affected the way that Taiwan's public health officials and clinical practitioners looked at infectious disease mitigation in Taiwan?
At that time, there was not, we were in the kind of transition period of, putting a lot of emphasis on the non-communicable diseases because people were thinking that infectious diseases were gone. We have good vaccine, we have good antibiotics. So the attention, the public health response to infectious disease or outbreak was slow and unprepared. So after the SARS outbreak, so there was a lot of discussion, and I think one crucial thing is that the government realized the importance of this basic public health infrastructure, especially for infectious disease control. So I think one important thing is that they established this EIS-like system, the Epidemic Intelligence Service. They recruited physicians to do infectious disease control.
Dr. Lin, I'd like to move to COVID-19. When an epidemic breaks, what does a well-prepared as opposed to a poorly prepared public health system do to spring into action and cope? And what kind of systematic responses did it trigger in Taiwan this time?
The initial response of the atypical pneumonia in China on December 31st was actually detected by a medical officer who was surfing the internet. There was a common portal called a PPT. It's a information exchange platform for everything. But he just the medical officer detected this kind of atypical pneumonia in China. So like early morning or late night. So on the same day, Taiwan CDC started. So we know that they knew that it's from Wuhan. So on the same day, they started to have this kind of onboard checking for all the flights, incoming flights from Wuhan. So they started on the same day, they detected this atypical pneumonia. So I think that kind of illustrated the swift response that the CDC had for, and since we have very, very, very close interactions, business, etc., with China, so and we know that there can be a lot of infections or outbreaks in China. So we've been keeping a very high level of awareness, particularly about the diseases from China. So that's I think that's one thing. Yeah. And then on the day, so we had the first, so that's December 31st. And then on January, I think 22nd or 23rd, we established the Central Command Center, the CECC, the Central Epidemic Command Center. And then the next day we kind of reported the first COVID-19 case. So the center was established before the first case. Yeah.
You know, what's garnered the most attention around the world in looking at Taiwan's experience with COVID-19 is the innovative use of technology for contact tracing, the enforcement of quarantine, and also the integration of national public health and immigration databases. Can you talk a little bit about technology-enabled solutions to infectious disease management and what the unique Taiwan way is?
A few examples that we use is kind of information system. So one thing is the face mask. So, you know, in the SARS outbreak, we learned that face mask will be gone very quickly if we have a major outbreak. So just at the very beginning of the outbreak, the government has started to ration the purchase of face mask, and at the same time started to increase the production of the face mask. And this was assisted hugely by the national health insurance system, because I'm trying to show you my card. Maybe I can show you. So we have this ID card, this national health insurance ID card. Everyone has one, and usually we use this card to do medical care. So when we see doctors, we use this card. But this is unique, and you know, everyone has it, and there's very good information system behind that. So it turns out the government make a lot of use of this IC card for buying this name-based face mask. That's one, I would say, one example. And then also this card, the hospitals learn that they have to be very careful in terms of screening patients. So the government also combined the immigration records, again, within this kind of IC card. So I would say most of the contact tracing was still done in a kind of conventional way. So people, you know, try to ask about where they go and ask about their acquaintances. And it's only when the source of infection was not very clear that people started to take advantage of this kind of big data. So mobile phone records about the locations or the venues that the index case went to, and also for certain like emergency situations, like we have this Diamond Princess cruise ship. Before the outbreak, they actually landed one of the harbors in northern Taipei, and more than 2,000 passengers actually, went into Taipei, went to different places. So they were able to make use of this mobile phone signals so that they can, within a matter of day or two, identify all the kind of high-risk hotspots, places that these people went.
Dr. Lin, one last question. What are the top lessons from Taiwan's experience that you think can be exported, scaled, and emulated around the world to become not just a Taiwan way, but global best practices?
The very high level of face mask use, I think, very likely prevents the sort of hidden or unknown sources of transmission in Taiwan. I think lastly is that the public health infrastructure. We do contact tracing, swift contact tracing. When the number of cases is not like thousands or dozens of thousands. Within the capacity, we do very prompt contact tracing, followed by quarantine among the close contacts.
Well, Dr. Lin, Taiwan's story is amazing, and there's so much for the rest of the world to learn. Thanks so much for sharing it with us.